Hello, everyone, and welcome to Question Lab. We're happy to have you here tonight as we dissect questions and discuss the topic of physiology. Leading tonight's session once again is Dr. Paras Vicaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident currently. I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as yourselves, and I help prepare you guys both for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session on physiology.
We have a question box. You'll see it on the right side of your GoToWebinar control panel. You can type your questions there, and our panelists will do their very best to answer your questions. We're a little short-staffed today, but we'll do our very best. I know I mentioned RX Coach earlier. RX Coach is our coaching and tutoring program where we work with students one-on-one to help them accomplish their academic goals. We'll talk more about RX Coach later, but what I want you to know for now is that the methodology that we will employ this evening as we dissect these 4 questions will be similar to the methodology that we employ in RX coaching sessions. So with that, let's go ahead and get started with our first question on the topic of physiology. As always, the answer choices are always covered up. The reason we do that is because we don't want the answer choices to guide or dictate your thought process. And we don't want you to see an answer choice that you're unfamiliar with, which may cause you to panic as you're trying to answer the question on test day. So I've gone ahead and removed those choices for you. After that, we'd like to begin by reading the lead-in. The lead-in is the last sentence of the question itself. And the reason why we read that first is because we want you to know what the test writer is asking. This way, when you are reading the vignette, you can pick up on all those relevant clues without having to reread that vignette and waste valuable time on test day. So let's take a look at that lead-in now. Which of the following is the most likely explanation for the limited response to potassium administration? Which of the following is the most likely explanation for the limited response to potassium administration? After that, we'd like to ask our students how many steps they believe this question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. An example of a 3-step question is if you're asked for the mechanism of action for a treatment for a diagnosis. So I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll go ahead and move on to the vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 45-year-old man is brought to the emergency department after losing consciousness. After he regains consciousness, he begins to experience tremors and delusions. There is no vomiting or diarrhea. Family members indicate that he has a long history of heavy alcohol use with multiple episodes of withdrawal. His potassium level is 2.9. The ECG shows U waves. After administration of potassium intravenously, the serum potassium level rises to 3. Which of the following is the most likely explanation for the limited response to potassium administration? Paras.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in this vignette and the lead-in. And so starting off, generally the first thing you're going to get in a vignette is the demographics. In this case, we're told it's a 45-year-old male. So that you generally want to make note of that because that can automatically start to clue you in on what you should be thinking of. Okay. And then usually they tell you, why are they coming to the hospital? Why are they being seen in the ER? In this case, it's because of losing consciousness. So you want to make note of that, presenting signs and symptoms. Okay. Now they didn't do that in this case, but a lot of times they'll also give you a little bit of information about duration. How long has it been going on for? A couple days, a couple years. So you can get a sense of whether this is an acute or chronic problem. Okay. Now, this question specifically told us about some physical exam findings he has that you definitely want to make note of, the tremors and delusions, some family history of alcohol use, and then some lab values, and then an important statement there about the limited response that he had with giving potassium IV. Okay. Now, this question, as Sean had read initially, was asking us for that explanation of why that happened. So I think we've got a couple steps here. I think we've got to figure out, maybe what's going on in this patient, and then two, what's the explanation for him not responding to potassium administration? This maybe could be a one-step question. There could also be a second step depending on the answer choices. So let's go ahead and let's take a look at those answer choices. And when we work with students, we recommend that as they go through the answer choices, they actually start at the bottom and work their way up to the top. So starting with answer choice E and then working your way up to the top. And the reason we recommend this is because a lot of times we'll see students who start at the top and they'll work their way down and they'll see something they like and they'll select it without having gone through all the choices. Sometimes they'll get that question wrong. So we actually recommend doing it this way to prevent yourself from biasing yourself. So let's go ahead and let's do that now. Answer choice E, volume depletion. D, metabolic acidosis. C, hypomagnesemia. B, hypocalcemia. And A, chronic kidney disease. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you very much, Paris. We've got the poll open for you, so please select what you believe is the correct answer, and then as always, we will review the correct and incorrect answer choices. I see the responses coming in. Once again, we'll wait until about 2/3 of you have selected responses. Remember that on test day, there is no penalty for guessing, so never leave a question blank, and especially today, if you're unsure, don't worry, your submissions are completely anonymous, and we will review the correct and incorrect answer choices later. All right, let's take a look and see what you selected. 38% of you selected hypomagnesia, and 29% of you selected metabolic acidosis. So let's take a look and see what the correct answer is. And the correct answer is C. So great job to those of you who got it right. It was a tough question. If you didn't get it right, don't worry. Just listen to Paris now as he explains it to us. Paris.
Thank you, Sean. Yes, great job, guys. So let's talk about what's going on in this question. So this patient was given IV potassium, but as you can see, it really only jumped from 2.9 to 3, even though it was IV, okay? Now, in this patient, we are also told that he's a heavy drinker, heavy alcohol use, okay? So we've got to be thinking about what could be related between that and the potassium not responding, okay? And people who drink alcohol heavily often have low magnesium. One, because they don't get it enough in their diet, and two, they have damage to their kidneys to where they excrete out magnesium, right? If we take a look at the next slide, this is a nice little table about electrolyte disturbances in first aid. You can see there, if you have a low concentration of magnesium, that can lead to hypokalemia, okay? And even hypocalcemia, okay? So patients with low magnesium are at risk of hypokalemia, okay? Low potassium. So this is something that you would want to correct in this patient, and along with correcting the potassium, okay? So if you have a patient in the hospital next time and their potassium's not responding, make sure you ask them about alcohol intake and make sure you check other electrolytes as well, including magnesium. Okay. So if we go back to our question, we take a look at the other answer choices. Volume depletion. There's really nothing in this question that's suggesting volume depletion, like diarrhea, vomiting, things like that. And that also wouldn't necessarily, you wouldn't have necessarily the issue of not responding to potassium supplementation. Metabolic acidosis would actually cause hyperkalemia, so kind of the opposite effect. Hypocalcemia is not something that's generally associated with refractory hypokalemia. And then lastly, Patients with CKD are also not at risk of developing hypokalemia, and those patients would respond if you gave them potassium. So not the best answer there. So the best answer choice here, like you guys selected, is answer choice C.
Excellent. Thank you very much, Boris. Great explanation. Great job, everyone. Let's move on now to our second question of the evening. As always, the answer choices are covered up, and we will begin with the lead-in. Which of the following is a normal function of the hormone that is most likely deficient in this patient? Which of the following is a normal function of the hormone that is most likely deficient in this patient? I'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require. Then we'll move on to that vignette. All right, let's take a look at that vignette. A neonate is examined in a labor and delivery suite. Examination of the baby's genitalia shows labial fusion and clitoral enlargement. Chromosomal analysis reveals the baby's karyotype is 46XX. The baby exhibits poor feeding and persistent hypotension despite multiple treatment measures. Further workup shows a deficiency of a hormone that normally maintains blood pressure and blood volume. Which of the following is a normal function of the hormone that is most likely deficient in this patient? Boris.
Thank you, Sean. So let's go ahead and let's take a look at this question now. Now we're working with a pediatric case, a neonatal case, okay? And, you know, automatically, when you see a question that Sean had read talking about deficient hormone, you definitely want to put on, you know, your endocrine hat, okay? And so you want to pick up on those things that could be getting you at an endocrine abnormality. And so we were told about some genital abnormalities. We're told about issues that the baby has with low blood pressure and feeding. And we're specifically told, actually, that that this patient does have a hormone deficiency, and that hormone is normal function, okay? So this question is asking us about the normal function of the hormone that's most likely deficient. So I think we've got a couple steps here. I think one, we've got to figure out what is a condition this patient has. Two, what is the hormone deficient in that condition? And three, function of that hormone. So I think we've got a three-step question here. So let's go ahead and let's take a look at those answer choices. And once again, we're going to start at the bottom, work our way up to the top. Answer choice E, renal sodium excretion. D, renal hydrogen ion excretion. C, renal collecting duct water reabsorption. And B, increased renin synthesis. And A, increased conversion of angiotensin 1 to angiotensin 2. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. The poll is open. For those of you wondering, next week's topic is immunology, and we hope you can join us. We do these question labs every Tuesday at 8 p.m. Eastern. I see some responses coming in. We'll give all of you a few more moments here. All right. So the response is coming in. We'll give all of you a few more seconds here. Looks like it's going to be close. All right, let's see what you selected. Well, C pulled out in the lead. So 35% of you selected renal collecting duct water reabsorption. In second place, we had renal hydrogen ion excretion. And A and E were tied for third place. So let's take a look and see what the correct answer is. And the correct answer is D, renal hydrogen ion excretion. And 20% of you got it right. So definitely a tough physio question. Let me hand it off to Boris.
Thank you, Sean. So let's take a look at what's going on. Definitely a tough question here, okay? So, you know, we're told about some genital abnormalities in this neonate, okay? If we take a look, this patient's got, you know, what we would call ambiguous genitalia, 46XX, but there's fusion of the labia, and the clitoris is enlarged, okay? So if we take a look at the next slide, this is looking at our congenital adrenal hyperplasia. Okay. Now, if we were to have a patient who is XX and has virilization, okay, virilization meaning more male-appearing genitalia, so clitoralomegaly, fusion of the labia, we would be looking at either B or C here, 21-hydroxylase or 11-beta hydroxylase, okay? Now, one of the things that then differentiates that is this patient has refractory hypotension, okay? So in 21-hydroxylase deficiency, you would have a low blood pressure, while in 11-beta hydroxylase, you would have a high blood pressure. So thus, we can point to this being most likely a 21-hydroxylase deficiency. Okay? In this patient, we have, or in this condition, you have high androgens or high sex hormones, and that's why a female gets virilized. Okay? You, however, also have low mineralocorticoids, and that's why you can get hypotensive. Okay? So as a result, one of the mineralocorticoids that is deficient is aldosterone. Okay? And aldosterone, as we know, it increases the reabsorption of sodium, it increases the excretion of potassium, and it also increases or promotes proton secretion. So if we go back to our question and we look at those answer choices, now knowing that we're talking about aldosterone, hopefully you can see that why answer choice D is the best answer. Okay? Answer choice E is incorrect because aldosterone actually promotes reabsorption of renal sodium. Answer choice C, that is done by antidiuretic hormone, not aldosterone. Answer choice B, increased renin synthesis. This is done by sympathetic response, so not directly aldosterone. And then lastly, answer choice A, this is not under direct hormonal control as well. So not the best answer here. So a nice three-step question that definitely required a little bit of endocrine knowledge as well. So a tough question here, but great job on working through this together.
Yeah, that was definitely a tough question. And physio is a topic that students often find challenging. And if you're finding physio challenging or any other subject challenging, or if you are thinking, I'm studying so much, but I'm not getting the results that I want, or you just want that extra edge, maybe you want to work on test taking skills. Maybe there's certain topics that you need help with, or maybe you want an efficient study plan that will save you time as you're studying, or maybe you want somebody to guide you and make sure that they're finding your knowledge gaps and identifying them and bridging them in a timely manner before it's too late. Because once you fall behind, it's really hard to catch up. If any of those interest you, you should consider working with one of our RX coaches. If you're in medical school studying for block exams, we will actually just look at your syllabus, your learning objectives, have you fill out an intake form, and then based on that and your learning style and the resources you have, we'll create a personalized study plan for you. If you're studying for a comprehensive exam or a board exam, we'll administer one of our assessments, and we'll base your study plan on that assessment and other periodic assessments as well. We're the only tutoring company, or at least one of the only tutoring companies, that's been in medical education prior to entering the tutoring space. That means that we've authored our own resources. Our founders authored first aid. Our founders created USMLE-Rx, which means you'll get access to our resources such as our question bank, RX bricks, our flash facts, our videos. You'll get a whole suite of products to help assist you through the process. And because we created all of these tools, we have a lot of data with our faculty portal that really helps us guide your study process and your studying journey. So if you're interested in working with a coach, they're all very highly trained and certified. As you met Paras earlier, we've got several coaches just like him. Reach out to us at rx-coach or rx-coach.com and click on that free consultation button to discuss the program and how it can benefit you. Once again, that's rx-coach or rx-coach.com. And that free consultation is to discuss the coaching program to see if it's a good fit for you. With that, let's go ahead and move on to our third question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Serum concentrations of which of the following have decreased in this patient over the past year? Serum concentrations of which of the following have decreased in this patient over the past year? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question requires, and then we'll move on to that vignette. All right, I see the responses coming in. Let's take a look at that vignette. A 35-year-old woman comes to the physician for an annual examination. Vital signs are normal. Body mass index is 24. 1 year earlier, her BMI was 31. Serum concentrations of which of the following have decreased in this patient over the past year? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so now we've got a 35-year-old male, and you can see here we've got a very short vignette. Okay, so we're not really dealing with a lot, but in that case, every clue they give you is going to be that much more important. Okay, so we're given some information about BMI. In this question, they're asking us about the serum concentration of something that's decreased in the past year. So I think, we've got to figure out, one, maybe what's going on in this question, and then two, what may have decreased in this patient over the past year. Okay, so maybe a two-step question here. So let's go ahead, let's take a look at those answer choices. Once again, we're going to start at the bottom. We're going to work our way up to the top. Answer choice E, somatostatin. D, leptin. C, ghrelin. B, gastrin. And A, cholecystokinin. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer, and we'll talk about it in just a few seconds.
I'm going to go ahead and read that lead into you one more time, as we had a little copy and paste error here. Serum concentrations of which of the following have decreased in this patient over the past year? So there's the poll. Once again, that vignette lead-in reads as such. Which of the serum concentrations of which of the following have decreased in this patient over the past year? So I'll give all of you a few more moments here to submit your responses before we move on to the correct answer. All right, so responses come in. Give all of you a few more seconds here. All right, well, let's take a look and see what you selected. Well, 49% of you selected ghrelin and 37% of you selected leptin. So let's take a look and see what the correct answer is. And the correct answer is D, leptin, and 37% of you got it right. So another challenging question. Let me hand it off to Paris.
Thank you, Sean. Yes, definitely a tough question here. So let's take a look at what's going on. Okay, so as you can see, the most important thing that they gave us, really the only thing they gave us, was that change in BMI. Okay, we can see that this patient went from a BMI of 31 to 24. Okay, so this patient has lost a significant amount of weight, assuming their height hasn't changed. Okay, now weight loss is accompanied with lower levels of leptin. Okay, and increased sensitivity of the leptin receptor. Leptin is an appetite-regulating hormone. Okay, if we take a look at the next slide, we actually have a nice table in first aid that talks about appetite regulation. And if you see there, the second row talking about leptin, we can see there that obese people have increased leptin due to increased adipose tissue. Okay. Sleep deprivation or starvation leads to decreased leptin production. Okay. So in this patient who has been losing weight, it's most likely that this patient now has a decreased leptin because they have decreased adipose tissue. Okay. On the other hand, ghrelin is something that would be increased during dieting. okay? So kind of the opposite. If you're dieting, your ghrelin would be increased. If we take a look at our question now, hopefully you guys are able to see why that is the best answer. The other answer choices don't really fit in here. You know, they don't really have as much to do with appetite regulation, and they're not affected by weight change. So not as good answer choices, and like you guys selected, really came down to C and D. So hopefully you guys are able to pick up on why D is the best answer here.
Excellent. Well, thank you, Paros. Let's move on now to our last question of the evening. Let's try to finish strong. And of course, after this, we will have our raffle and special offer. Next week's topic, once again, is immunology, and we hope to see you here. Let's begin with that lead-in as always. Which type of transport is most likely being inhibited in this experiment? Which type of transport is most likely being inhibited in this experiment? We'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. All right, let's take a look at that vignette. A researcher is studying the human nephron and the effects diuretics have on each segment. During his experiments, he uses a thiazide diuretic to inhibit a sodium transporter. Which type of transport is most likely being inhibited in this experiment? Paros.
Thank you, Sean. So once again, we're going to show you what we think are the important clues in this vignette. And now we've kind of done this 4 times, and you can see a lot of times with these physiology questions, kind of have a little bit of a shorter vignette. You may not be getting that full clinical vignette, okay? So it's important that you really hone in on what they're asking in that question first, and then go and look to see what are the important clues in the vignette. Okay, so in this question, we'll take a look at what we think are the important clues once again. Okay, and in this question, we can tell that it's specifically, looking at thiazides, okay? In this question, they're asking us about the type of transport being inhibited. So I think we've got a couple steps here. I think one, we've got to know the mechanism of the thiazide diuretic, what it inhibits, okay? And 2, what type of transport is that that is being inhibited? So I think we've got a 2-step question here, okay? So let's go ahead and let's take a look at those answer choices. Once again, we will start at the bottom. We'll work our way up to the top. Answer choice E, secondary active transport. D, primary active transport. C, facilitated diffusion. B, carrier protein. And A, antiporter. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
All right, everyone, the poll is open. This is our last question of the evening. Let's try to finish strong. And then, of course, we'll have a raffle and special offer for all of you. I see the responses coming in. We're about a quarter of the way there. I'll give all of you a few more moments. Once again, if this is your first time joining Question Lab, please let us know in the question box. We would love to hear from you. All right, well, let's take a look and see what you selected. 33% of you selected primary active transport and 25% of you selected secondary active transport. The correct answer is E, secondary active transport, and a quarter of you got it right. Another challenging physio question. Like I told you, if you're having trouble grasping these physio concepts, maybe it's time to get a coach. So check us out at rx-coach.com. Paros.
Thank you, Sean. Yes, definitely a very nice physiology question. They love to ask about this. They love to ask about the receptors and the transporters that are inhibited by medications, and how do those transporters work. So we know we're being told that this is a thiazide. So let's take a look at the next slide. And if we take a look there, you can kind of see the mechanism of thiazides, and you can see that it inhibits that sodium chloride transporter. Okay. Now that sodium chloride transporter really is only working because of that sodium-potassium ATPase on the basolateral membrane, if you see that, okay? So the sodium chloride transporter, that is a symporter. That is two things moving in the same direction. Sodium and chloride are moving in the same direction, and that's called a symporter, okay? But this is not primary active transport, okay? That transporter in and of itself is not using ATP, okay? So it is not primary active transport. But you can see it's using the effect of that sodium-potassium ATPase, which is primary active transport, okay? What happens is by pumping sodium out of the cell with that sodium-potassium ATPase, you are creating a gradient that sodium can now go down, okay? So sodium can now go down in that sodium chloride transporter. Sodium can go down its gradient, and it is also bringing in chloride with it. So it's using active energy, but it's not that transporter that has the ATPase function. That's called secondary active transport. Okay, so hopefully you guys can see that now. If we take a look at the other answer choices, primary active transport is something that uses ATP directly to power movement of something. In this case, that's not the sodium chloride channel or transporter. That's actually the sodium potassium ATPase. Facilitated diffusion is something where you have a diffusion gradient, and as a result, it can just diffuse across a membrane, for example. It doesn't need a transporter, and so in this case, obviously, not the best answer choice. A carrier protein is something where it requires a molecule to bind to it, specifically to enter into the membrane, and doesn't necessarily require a gradient. An antiporter is something that moves two things in the opposite direction. So if sodium and chloride were moving in opposite directions, that would be an antiporter. In this case, we see that they move in the same direction, and so that's a symporter. Okay, so some nice physiology questions here today. Great job on these questions today, and I'll hand it back to you, Sean.
Well, thank you very much, Boris. Great job as always, and thank all of you for attending. If you want to study these questions in more detail and make sure you've mastered the concepts, take note of these QIDs. I'll leave it up for a second. Take a picture, write them down. And you can simply log into USMLE-Rx, type these numbers into the Rx search field, and it'll actually just pull it up so you can take a look and take a deeper dive.